All right, everybody, we're going to get started today. So hello, everybody. Thank you all for being here tonight for our highly anticipated nationwide panel discussion on the gendered impact of COVID-19. Our aim today is to create a safe space to discuss this important topic and foster informed conversation and collaboration between our esteemed panelists and our audience members. My name is Maggie LaRock, and I'm the co-chair of McGill Students for UN Women, and I'll be your host and moderator on behalf of our organizations tonight. This event would not be possible without the months of preparation and collaboration with fellow gender equity clubs across Canada. This event was collaboratively created by UN Women of U of T, U Alberta's Champions of Change, Queen's U Students for Women's Global Rights, SFU International Justice Mission, and McGill Students for UN Women. This event is possible because of the incredible commitment by the women running these organizations across the country. Our collective intention behind this event is to foster discussion centered on how women and femme-identifying folk have been disproportionately affected by COVID-19 in the sectors of education, labor, domestic violence, and mental health. Within this 2-hour panel discussion with an additional Q&A period, we hope not only to discuss this important topic, but also to connect our audience members with our esteemed panelists to continue this conversation. A student-run, female-ran virtual event of this scale and magnitude has never been done before, and we couldn't be more excited to kick off our debut collaborative event. Before diving into the panel discussion, I will first introduce Melissa, a representative from U of T, to explain our raffle draw, followed by a nationwide land acknowledgement and speaker introductions. Over to you, Melissa.
Hi, everyone. My name is Melissa, and I'm one of the executive directors for United Nations Women at the University of Toronto. And once again, thank you all so much for attending this amazing event, and a huge thank you goes out to all of the universities that made it possible. In honor of the event, we are having an ongoing giveaway to raise money to support the organization Women's Health in Women's Hands. It's a community healthcare center that provides primary healthcare to racialized women from African, Black, Caribbean, Latin American, and South Asian communities. You can win up to $50 to Badge and Boo, which is a female-owned Canadian business that specializes in making face masks that promote diversity and intersectional art. Please click the link in the chat to find out how you can donate. We will keep the raffle open until 4 p.m. today, which is right before we start our Q&A session. Without further ado, Maggie, the virtual floor is yours.
Thank you, Melissa. We're just going to begin with our land acknowledgements. So collectively, we aim to strive to align our goals, visions, projects, and with anti-racist and anti-colonial practices. We cannot attempt to address issues of gender inequality without recognizing the role of colonialism and white supremacy in the continued mistreatment and abuse of Indigenous women and 2S LGBTQIA+ individuals in the Canadian context. As a Canada-wide event and acknowledging Canada's history with Indigenous peoples, we would like to respectfully acknowledge the traditional lands that we are all remotely working on. I will now pass it over to my colleague, Alexandra Beck, who will provide the Montreal-based land acknowledgement.
McGill University, Tiohtià:ke, Montreal, is located on land which has long served as a site of meeting and exchange amongst Indigenous peoples, including the Kahnawake of the Haudenosaunee Confederacy, Huron-Wendat, Abenaki, and the Anishinaabe nations. McGill Students for UN Women recognizes and respects the Kahnawake as the traditional stewards of the lands and waters on which we meet today. Rupali, go ahead with the University of Alberta land acknowledgement. Thank you.
Thank you. The University of Alberta respectfully acknowledges that we are located on Treaty 6 territory, a traditional gathering place for diverse Indigenous peoples, including the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Saulteaux, Anishinaabe, Inuit, and many others whose histories, languages, and cultures continue to influence our vibrant community. I'll pass it off to Neha from U of T.
Thank you. United Nations Women, University of Toronto wishes to acknowledge the land on which our university operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit River. The territory was the subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Iroquois Confederacy and the Ojibwe Allied Nations to peaceably share and care for the resources around the Great Lakes. This meeting place is still the home to many Indigenous peoples from across Turtle Island today, and we are grateful for the opportunity to work and learn on this land. I'll pass it to Jen from Queens.
Hello. To begin, let us acknowledge that Queen's University is situated on traditional Anishinaabe and Haudenosaunee territory. We are grateful to be able to live, learn, and play on these lands. To acknowledge this traditional territory is to recognize its longer history, one predating the establishment of the earliest European colonies. It is also to acknowledge this territory's significance for the Indigenous peoples who lived and continue to live upon it and whose practices and spiritualities were tied to the land and continue to develop in relationship to the territory and its other inhabitants today. Samia, the floor is yours.
Thank you, Jen. International Justice Mission Simon Fraser University respectfully acknowledge that the land we are located on the unceded, ancestral, and traditional territories of the Tsleil, Waututh, Squamish, Musqueam, and Coquitlam nations. Thank you. Over to you.
Excellent. Thank you so much, everybody, for your land acknowledgements. Here we have resources to learn from, which I've also included in the public chat. So if you want to save any of these resources, please feel free to. In particular, nativeland.ca is a really useful resource. All right, so considering that we're all working remotely, we encourage everyone to learn and acknowledge the colonized land that you are working on currently, and we have provided resources to do so. And now over to Krista to discuss our club information.
Hello all. If anyone is interested in getting involved with or learning more about any of our student-run organizations, please feel free to look at this slide and note down the contact information and handles. And of course, if you have any questions, please feel free to send any of us a message. Thank you.
Excellent. Thank you so much, Krista. We'll now dive into our speaker introductions, and I'll pass the mic back over to my colleague, Krista.
Okay. Diana Arango is a senior-based violence and development specialist in the gender cross-cutting solutions area at World Bank Group. She has more than 10 years of experience working on development issues, including gender-based violence, specifically within the context of humanitarian settings. Before joining the World Bank Group, she was a research scientist at George Washington University's Global Women's Institute, leading research on violence against women and girls in conflict settings. Prior to that, she served as the global coordinator for the development and implementation of the Gender-Based Violence Information Management System, an innovative interagency initiative that aids humanitarian workers in collecting timely data on GBV incidents that can be used to inform programmatic work. She has an MSc from the London School of Economics in Anthropology and Development and has on-the-ground experience in several countries, including Colombia, Haiti, Chad, Somalia, Uganda, and South Sudan. Now we have Dr. Sandra Moore.
Dr. Moore is the Dean of Academic Resources and Administration at New England College of Optometry in Boston. She holds a doctorate in education and has accomplished 20+ years of experience in higher education. Dr. Moore is importantly recognized in her field as a leader who supports faculty in teaching, scholarship, and service while upholding the academic and accreditation service standards. She is also well-versed in financial aid, development, and career coaching. Dr. Sandra Moore also has a vested interest in achieving gender parity in senior leadership positions and is the mentoring chair with the Women's Accelerators program. Next, I'll pass it on to Oya, who will introduce the Honorable Dr. Carolyn Bennett.
Thank you, Julia. The Honorable Carolyn Bennett was the first elected to Parliament in 1997, and she was re-elected 8 times. She is the member of the Parliament for the riding Toronto-St. Paul's. Under Prime Minister Paul Martin, Carolyn was appointed the Minister of State for Public Health. In November 2015, Carolyn was appointed Minister of Indigenous and Northern Affairs by Prime Minister Justin Trudeau. In 2017, she became the Minister of Crown Indigenous Relations and Northern Affairs with a mandate to guide the government's forward-looking and transformative work to create a new relationship with Indigenous peoples. Carolyn was appointed as the Minister of Crown Indigenous Relations in 2019. Prior to her election, Carolyn was a member a family physician and a founding partner of Bedford Medical Associates in downtown Toronto. Carolyn's fight to save Women's College Hospital in Toronto is what inspired her to enter politics. Now the system is her patient. Now we have Angelina to introduce Dr. Abhi Sriharan.
Thank you. Dr. Abhi Sriharan is an internationally recognized academic with a wealth of experience in human resources and human capital strategy in the health sector. Dr. Sriharan leads the Systems Leadership and Innovation Program at the Institute of Health Policy, Management, and Evaluation, and teaches in the areas of health systems leadership, innovation, and transformation at the University of Toronto. She served as a consultant for multinational organizations such as the World Health Organization, the World Federation of Neurology, the Middle East Hearing Association, and the Canada International Scientific Exchange Program on issues of management, engagement, training, and governance of the health workforce and health systems. Her latest research has centered around burnout and the implications of COVID-19 on female healthcare workers. I would also like to introduce to you our final panelist, Naomi Nyamweya. Naomi Nyamweya is a Kenyan accomplished research officer at the Malala Fund. Using data-driven research and policy analysis, Naomi's research is used to drive support for the Malala Fund's advocacy for girls' education and to establish the organization's policy stances. Notably, Naomi has led the charge in research regarding the impact of COVID-19 on the education of women and girls, particularly those in refugee communities. Under the Malala Fund, her work has been published and are archived under organizations like Global Partnership for Education, UNICEF, and the European Commission.
Excellent. Thank you all for introducing our esteemed panelists. And now it's time to begin the panelist discussion. For simplicity's sake, we will maintain an order of response for the panelists. The lineup will begin with Diana, followed by Sandra, followed by Carolyn, Bennett, Dr. Abhi, as well as Naomi. This order will remain the same for each question and response period. Thank you. I will now provide a brief reminder of our discussion topic today. Globally, COVID-19 has had a tremendous socioeconomic impact on women and girls. It has impeded them from receiving an education, pursuing economic opportunities, having access to basic sanitation and vital health care, and placing women and girls at greater risk of all forms of violence and abuse. The pandemic did not create these detrimental issues faced by women and girls globally, but instead perpetuated them to a greater extent, forcing citizens of the world to confront this harsh reality. We would like this panel discussion to be conductive and thoroughly analyze the aforementioned issues and brainstorm potential solutions to them. Now on to our first question being presented by Alexandra Beck.
Hi, so as Maggie mentioned, COVID-19 is unraveling progress on gender equality and girls' rights globally and here in Canada. Do you think the effects of COVID-19 that have been felt by the women you work with could have been better mitigated? How could local, national, or international responses have been better? Diana, would you please start us off?
Thank you, Alexandra, for that question, and thank you so much for inviting me to be part of this panel. I'm super excited to be with you all today. As Krista mentioned in the introduction, I work for the World Bank, so I'm going to focus my responses on how we've been perceiving the issues of gender inequality in low and middle income settings that we work in. And so we absolutely have seen an impact in low and middle income settings from this unprecedented event that we feel no government really was fully ready for. And we've noticed how this has impacted the lives of women and girls in particular. Since I work particularly on gender-based violence, we saw that a lot of services that women who've experienced gender-based violence, and I'm sure many of you might know that 1 out of 3 women worldwide between the ages of 15 and 49 experience intimate partner violence or sexual violence by a non-partner, right? And so those services that those women need are psychosocial support, health support. If they are survivors of sexual violence, they need access to post-exposure prophylactics, emergency contraception to stop any unwanted pregnancy. Those services started to be declassified as essential services globally with the response of the pandemic. We also saw maternal and health services or wards being taken over to respond to the pandemic. So areas of health where women's needs are met were kind of pushed to the side, and the COVID pandemic response kind of took over. And so we've had to do a lot of advocating with governments to continue to keep those services as essential, to continue to keep those medicines women survivors of sexual assault need as essential medicines during the pandemic. And we're making some progress in getting those back on the list. But the first reaction that we saw globally when we entered with financing to support the response through the health sector for COVID-19 was really kind of getting those services shut down or moved out of hospitals, moving them away from areas that women knew where they were, and so obviously limiting the access that women could have. We also noticed that a lot of women work in the informal labor market, and that our social service systems weren't ready to reach out to them for economic support during this time. And really they had kind of daily economic activity that they had to participate in. So those policies that were enacted to protect the spread of COVID-19, to protect women against getting COVID-19, were actually limiting their participation in the labor force with no backup form of economic support ready to identify those women and to get them kind of into that service. So we saw that very much. We also saw a shift to moving to mobile services. A lot of the women and girls in low and middle income settings don't have access to cell phones or to computers, or often share those resources within their home, and they don't control them privately. So it was great for the psychosocial support services, the justice protection order services that could move into remote delivery, but we felt like there has been a huge gap in reaching those women and girls, especially that are survivors of violence, that are at home, often living with their abusers and unable to reach services safely. All this to say, and I'm hoping not to get a 5-minute warning, that we have seen really great innovation also during COVID-19 in low and middle income settings. So once we started understanding the limitations of our pivoting to remote services and that they weren't getting to some women, we've seen things like gas stations using code words for women that could just walk up at, gas stations here in Colombia, where I am right now, are open 24 hours a day. There was a code word that was installed in Bogota, the capital's gas stations, where women could walk up any hour of the day, say the code word, and the person attending the gas station would know that this is a survivor in need of services. So we've seen great innovation. We saw supermarkets open up, rooms in the back of supermarkets where they would set up computers and also give women access to remote services. So we weren't ready, but we've understood that we weren't ready, and we're constantly reprioritizing, pivoting, and innovating to try to reach those women who are most affected, women and girls in low and middle income settings that are most affected. We have a long way to go, but this is definitely something that I think currently all low and middle income governments are also learning from each other. We're tracking globally. We're able to share what's being done in Africa with what's being done in South America and Asia. So it's led to a lot of innovation and thought around this. But had services, been there for women in remote communities, there are no services. So they've never had services. So yeah, in some remote communities that we work in, there is just lack of any type of service for survivors of gender-based violence in particular. And so we need to build back better, which means make sure that those services are there for women after the pandemic, and really show kind of the data, gather the data showing those gaps right now to help fill those gaps in the future.
Thank you so much. Sandra, would you like to speak on this question?
Hello, everyone, and thank you for inviting me to be here with all of you. And I really appreciate all of the work that the committee has put into designing and delivering this important session for all of us today. Events like this take a tremendous amount of time and coordination, and often it's through dedicated women who want to create change. And they're providing all of us a chance to think more about these issues and create better systems through all of the work that we do. And I also want to extend my appreciation to each of you in the audience today. You're taking the time to educate and learn more about these important issues. And it gives me great hope to see how many individuals are passionate about changing the world and making it a more equitable and inclusive place. What a great way to celebrate International Women's Day this year, which is tomorrow, if you weren't aware. And so our opening question is really a great one. And one of the most important things about creating change is understand what's been done in the past, what we're currently doing, and ways to work on creating a better future. We could have been more prepared. None of us knew what the pandemic was going to do, and many of us never expected that it would last as long as we did when things first began. I remember in my job, the president said, "We'll be back in 2 weeks, everything will be fine." A year later, and we're still working through some of these issues. What COVID-19 is forcing us to do is to look more deeply at other issues and challenges that impact the world and people, and we're working together to try and address them. COVID-19 is a health crisis, but it has created massive social and economic impacts that magnify some of our biggest challenges as a species. Just a few of the things that we need to focus on include having an equitable healthcare system where everyone has access to services and resources that are needed to keep them healthy. We need to come up with better ways to address childcare crisis through governmental initiatives and private employer support. And we need to create work policies that enable families to manage caregiving responsibilities and work responsibilities. In the introduction, they shared that I work in healthcare and education. And women tend to be highly represented in healthcare fields, which means that they're oftentimes more susceptible to catching COVID-19 because they're working with people who may have COVID or may not even know that they have it. There's also a care crisis where women are expected to take on home-based care, be it for children or parents, and even becoming teachers. I know many of my friends with young children never appreciated their teachers like they do now. I'm still not sure that I've got second grade math, trying to understand this new math system. We're also trying to make sure that women have access to healthcare services when they're needed. And I think Diana brought up some great things that people are doing for creativity during this time. Looking at ways of helping people with mental health issues. When you bring self-isolation into the mix, it increases everything else that's going on in one's life. And we also know that women tend to work in low-paid jobs, things like grocery stores, daycare centers, and nursing homes. These contributions need to be valued, and they need protections for the work that they're doing. Do they have social protections for things like healthcare, sick leave, and unemployment? And we also see that women are losing their jobs more to shifting in economic climate. Now, higher education has also lost jobs across the sector. They're seeing closures and mergers, at least in the United States. There's lots of layoffs happening for people, and education also tends to have a lot more women focused within the field. Jobs are not being replaced for things like normal turnover, and you also see a surge in retirements. And the important part here is that when these losses happen, services that were provided are not being provided through those positions that are lost. What does that mean to what it is we're providing? So together we need to look into the future and focus on sustainable development, which really means creating more equal and resilient societies for the future. Our past normal helped lead us towards this pandemic. What we do now and moving forward will determine the future that we live in. Together, we all need to build something better. And each of you as future leaders in your careers will have an impact in creating that future.
Thank you so much for that great answer. Caroline, the floor is yours.
Sure I am. Thank you so much, Alexandra. And I too want to just thank you for the beautiful land acknowledgements. That was really spectacular as we recognize all of the territories in which we are now working. And I'm here in Toronto at my home on the traditional territory of the Mississaugas of the Credit, where we do honor all of those Indigenous people who paddled these waters and whose moccasins walked these lands. It is, I really do want to just begin by saying congratulations. It was inspiring just to hear all of the organizations that you represent, knowing that you are all working for change, which is really what this is about, us having a fairer society and for us to be able to help around the world. And I just am already inspired. So it's already my sort of brain spa for going forward. So I think that, when COVID hit, I think we thought it was a health issue and that was going to be like SARS had been. We then very quickly realized that it was going to actually just level the economy and we had to shut down. And so I think what happened in Canada was that we knew we had to be fast, not perfect. And so therefore had to move quickly on things like the CERB or the response benefit, the wage subsidies, all of those things. And we went quickly in there. But I do want to say that from the beginning, there's no question that there had to be an intersectional feminist lens on everything we did. And really everything that comes to cabinet has to have that lens. And so that is, I think, helped. And I think that it meant that we quickly understood how much parents were struggling, how much often, particularly, I remember hearing from people saying that even though they weren't working from home, they were staying at home trying to work, meaning that the stress of what it is to actually have children not in daycare, not in school, and that women, of course, take on so much of that responsibility, as well as women as the healthcare guardians of their families. The fact that their mother in long-term care, or the kinds of concern that there has been about not being able to be together to help one another, I think has been particularly stressful in terms of some of the guilt that I think women felt, that they just couldn't go into the long-term care facility and help their mother or their aunt. So we also know that that, as it's called, a she session, that so many women have lost their jobs. I think today the Royal Bank of Canada says that 100,000 women have left the workforce since COVID, that 10 times greater than the men. And so I think that we also know that women-led businesses have struggled because the big box stores stayed open, but their the small retail outlet had to remain closed. And so this has been the reason why the response had to be immediate for frontline organizations that were helping, but also, as we'll speak about in a later question, this parallel pandemic of domestic violence that really was so clear. As men weren't going to work, women no longer had an exit plan. And therefore, we were very worried. I know, talking to some of the shelter workers across the country, that they were worried they weren't seeing even the regular number of women because of this sort of imprisonment. And I think some of you know the Canadian Women's Foundation actually developed a signal on Zoom calls to be able to let people know that they actually needed an intervention. So at the beginning, Minister Monsef was able to put $100 million towards those frontline organizations that were supporting women and trying to help them with exit plans, and especially those that knew that they need a safe place to turn. And I think all of the organizations coast to coast to coast were able to also get support from her department in terms of, I think, 1,500 organizations. Recently, Minister Mossop has also launched another $100 million for the Feminist Response and Recovery Fund that will support to accelerate the progress on gender equality and to ensure that Canada's response to and recovery from COVID-19 is inclusive of the diverse women. So what she is doing now is launching an action plan for women in the economy, and that plan will be guided by a task force of experts whose diverse voices will make sure we have a whole of government approach, but will address the unique characteristics of the crisis, but also the disproportionate impact that COVID has had on women. We are looking forward to Minister Freeland's budget this year, focused on a feminist recovery that will prioritize the needs of those that have been disproportionately impacted by COVID-19. There's also a fund for women entrepreneurs who have been challenged in that women's entrepreneur strategy. So one of the other things that I think we've seen in terms of what contagious diseases always show us is that if people don't have a safe place to live in amongst the Indigenous communities where if you have 3 generations, 17 people living in one house, this is not safe. And so we are really moving on the affordable housing strategy. Minister Hussein with the Rapid Housing Initiative, that's $1 billion to have 3,000 new permanent units. So it is and again, we go back to never have anybody understood more clearly how important quality childcare is for everyone. And I think that this has been when grandparents can't help out, when there's no informal approach, we actually do need a quality childcare system coast to coast to coast. So I'll leave it there. But once again, I just want to say thank you all. This has been such an important conversation.
Thank you so much for that lovely response. Abby, would you like to go ahead?
Thank you. And again, like my panelists, thank you for the opportunity to share some of the work that I have been doing around COVID-19 and burnout. And like my colleague said, women were disproportionately facing a lot of issues due to COVID-19. And I was working on that intersectionality with women and women in healthcare. The issues that they were facing were multiplied. So all the things that we were hearing, the women in healthcare were facing multiplied impact. If you know, 80% of our healthcare workforce is made up of women. And when we talk about healthcare women, all of a sudden the image that comes to our mind is mostly doctors, nurses, right? But then we don't think about all the other healthcare workers, PSWs, the operational staff who are responsible for cleaning every COVID-19 wards, the hospitality staff. So these are people who most of the time rely on hourly paycheck to paycheck. And in many places, they are not even protected by health insurances and things. One example is like when the US introduced the US Families First COVID-19 Response Act. There was which required the employers to give up to 80 hours of paid sick leave for people with COVID-19. There was a provision in that act to exclude healthcare workers, right? Think about that. Because there's a system that expects the healthcare workers to be there and take care of the patients. So there's also this moral distress that the healthcare women were facing. They had to be on the front line taking care of their patients, but then they were also facing all these factors. They had children at home because of lockdowns. They had parents in long-term care facilities. Some of them were losing their jobs. Doctors, nurses, PSWs were losing jobs because of sometimes, especially like when the hospitals were triaging and saying that they were only going to focus on COVID-19, other services were shutting down. elective surgeries were shutting down. So if you're a nurse working in an OR doing elective surgeries and you get reassigned to COVID-19 wards without your willingness, right? So there was a lot of these social systems factors that were happening. So could we have mitigated some of these issues? Maybe, maybe not. Again, this is a new issue, like no one experienced or planned for COVID-19, and there was a lot of unknowns. Year ago, we didn't know this is going to be this long, right? But we learned a lot, and the good thing is organizations, the systems are starting to pay attention. They know they can't function without this health workforce if they don't put investment into restructuring, supporting healthcare workers, they can't sustain. We saw that in the long-term care centers in Ontario and Canada, right? So we are seeing these things. So things are starting to look better. There's a lot more attention. There's a lot of research coming out. But again, the research is more focusing on, let's look at the mental health of healthcare workers. So let's do a point in time survey, look at whether they have stress, burnout, depression, anxiety. And then most of the time the interventions are, okay, let's give them some tools to manage their stress, their burnout, or coping strategies without thinking about what do we need to do in terms of systems. Could we rethink about additional human resources? How do we retrain or bring in more health human resources so we don't have issues with lack of health human resources? How do we provide them better support in terms of financial as well as systems, right? They have access to more PPEs and all the resources. If you look at especially the PSWs, they are on hourly salaries, and some of them are working very close to minimum average wages. And if they get sick and they can't go to work, they don't get paid. And if they don't get paid and they have families, their families are not going to be supported financially as well. And when people were losing, Ontario, when people were losing jobs, they were able to apply for additional fundings like CERB and things. But if you are a frontline worker working, and if you lose, you don't lose some shifts, you are not, in the early days, you were not able to apply for these things. So there was a lot of systems unconscious biases when it came down to policies in the early days. But again, things are starting to look better, and hopefully this is an opportunity for us to look at all the gaps and blind spots in our health systems and think about how do we address it so in the future we don't run into the same issues.
Thank you so much for those insights. Naomi, would you like to go ahead?
Yeah, so like everyone else said, I'm really happy to be here. It's a great way to celebrate International Women's Day, and we're really grateful for all the work that you've put in. I know this has been weeks in planning. I can imagine like the combined hours that it's taken to bring this together, and you have all done an incredible job. And yeah, I'm sure we can all say that our favorite people are doers, and you are doing the thing, which is great to see. So in response to your question, I'm going to come in from the education perspective, particularly education in low and lower middle income countries. And that's because Malala Fund is focused on challenging systems, policies, and practices so that all girls can access 12 years of free, safe, and quality education. So the first thing that we saw with the pandemic was a period of really long school closures. And in some countries, schools are still closed. So what this did is it widened the gap in educational attainment between the most disadvantaged children and the most advantaged children. And what we also saw is that this period caused a lot of learning loss. And so what this school closures did is that they threatened to extend beyond this generation and erase decades and decades of progress that had been made, largely affecting girls' and young women's education access and retention. And there was other periods where schools were closed for very long. For example, in Ebola, in some countries, schools were closed for an entire year due to the crisis. And what studies show is that 16% of girls that were enrolled in schools did not re-enroll once schools opened. So school closures kept them out of school entirely. And from this experience, we also saw that school closures make girls more vulnerable to things like child marriage, early pregnancy, and gender-based violence. And all of these things increase their likelihood to stopping their education, to a complete halt in their education. So last year in 2020, Malala Fund carried out a series of rapid surveys in 4 countries. This is India, Pakistan, Ethiopia, and Nigeria. And something that we saw is something that Sandra spoke of from her experience in the World Bank, which is the crisis of care. And even with children, you see that the burden of care falls more on girls than it does on boys. And so even if girls want to learn, they're unable to stay engaged in their learning because they're busy taking care of people in their homes or carrying out chores that are not necessarily carried out by boys. And these same social and gender norms play a very big role in educational investment decisions during lockdown and school closures, and even in the process of reopening. So there's the intra-household allocation of resources for schooling, both at the home level and both at the community level. And this is redirected more towards boys than girls. And so disadvantaged girls, especially those in rural areas, face very adverse effects. And in order to mitigate these effects, there was a need to ensure learning continuity. And so there were many learning continuity programs that were put in place. So there was learning continuity through radio, learning continuity through TV and online. And this was also accompanied by the provision of resources such as radios, textbooks, and study guides. But there's also something that I think Diana mentioned, which is the fact that women do not have access to mobile phones in the same way that men have access to mobile phones. And so then you can imagine that it's the same for girls. In fact, there's a study that shows that in the poorest countries, women are 33% less likely to use the internet than men. And so girls further have this negotiated access. So when you see provision of online learning, which is what emerged as the favored strategy, a lot of girls are unable to access this learning. And so that gap between boys and girls widens, but also the gaps between those that are able to access broadband and mobile network connectivity and those that are not able to access the internet also widens in that same way. And so in order to mitigate this, there was the need for targeted responses that understand the communities for which they are being built and that address the inequalities in access. And so to this end, Malala Fund has done some work. So as part of our COVID response in Nigeria, for example, we have an education champion called Kiki, who worked with teachers and education authorities to implement a radio program which broadcasts schools' lessons, including reading, writing, and STEM. In Lebanon, we have a champion called Naila Fahid, who is providing digital learning solutions to refugee children. And in response to COVID, they're also training teachers to deliver these interactive sessions from a distance. And in Pakistan, we funded one of our award-winning champions who before had digitized the national curriculum, but in response to COVID and due to the rising demand, worked on broadcasting these lessons on educational TV programs and has been able to reach more than 1 million children across the country. Something else that we know about schools is that they provide more than just learning. And for a lot of vulnerable students, school provides essential support such as the provision of meals. So for a lot of children, the meal that they receive in school is the only meal that they will receive in that day. And so when schools are closed, then there's a really big gap in nutrition. And so a lot of children are literally unable to eat. And so what local and national governments could have done to mitigate this is to replace these meals through cash transfer programs or through voucher schemes. From our rapid survey that I mentioned earlier in 4 countries, we found that 45% of households mentioned that they were facing food insecurity at the time, but only 32% of these households that were facing food insecurity had received some form of assistance from either the government or from an NGO. And interestingly, or not interestingly, maybe it's something that you would expect, in 3 of the 4 countries, that's India, Nigeria, and Ethiopia, we found that in the households where they were facing food insecurity, they were also less likely to report that the children in the household would be returning to school once schools reopened. And so providing this meal, any effort to reduce strain on family resources literally keeps girls in school. And so please, I don't know if I'm going over time, so if there's no chat, I can go on. So another way that the effect of COVID on the communities that we work with could have been mitigated is by ensuring the safety and well-being of teachers. So majority of frontline workers in education are women. 2/3 of teachers globally, 2/3 of primary school teachers globally are women. A half of all secondary school teachers worldwide are women. But while women are overrepresented in these frontline positions, they are underrepresented in higher education, and they're also underrepresented in educational institutions and educational ministries. So it's very difficult for decisions that are made in a lot of these low and lower middle income countries to meet the needs of these women. But at the very least, while schools were still open and as schools are still being open, governments should ensure that they protect teachers and that all health and safety guidelines are followed, that there are standard operating procedures in place, and that these are very strictly implemented. And in the countries where vaccines are, because it has to be clear that in Western countries, yes, there are vaccines, but in a lot of the world, there are no vaccines. So in the countries where vaccines are, a good step is to prioritize teachers' vaccinations, because that keeps them safe as they continue to provide this very essential service. And as far as the international infrastructure goes, it would have been great if donors adopted more gender responsive behavior. So humanitarian assistance and diplomacy efforts could have been aimed at stepping up the quantity and the quality of funding to support gender equality across key sectors, including education. So this could have been done by ensuring that funding is going towards local organizations that are working to equality for girls and women. And if these relationships already existed, then it would have been very easy to step them up. And even though they didn't, like as a crisis response immediately, that should have been something that could have been done. And lastly, I'll say that given the scale of this global education emergency, donor governments and international lending institutions need to ensure that their aid commitment remains the same. We're not asking for more, but we're asking for the same. If it's 6%, keep it at 6%. Even if the size of the budget of the budget or the size of GDP is shrinking, let's keep the share the same so that we can keep girls learning, especially the most disadvantaged girls and children in emergency situations who are most at risk. Yeah, that's.
Thank you. Thank you so much to all our panelists for your insights. I think this discussion has led us perfectly into our next question, which is how has the COVID-19 pandemic contributed to the further discrimination of historically marginalized women, such as in the socioeconomic or education spheres? For example, Black, Indigenous, and other women of color, trans women, and other women of the LGBTQIA+ community, to list a few. Diana, the floor is yours.
Thank you so much. I want to, with this question, which is a great question, and thank you for raising it, kind of go back to some of the things that I mentioned in my first response, and it's this limitation of access to services. And so if we already in low and middle income countries, in rural settings in particular, see very limited services for women and girls, we see even fewer services for marginalized women and those of different gender or sexual orientations, gender identities and sexual orientations. And so with the shutting down of services, with services becoming given it in a remote way, we actually don't have data exactly on the impact of this limitation in services, but since we know historically that these women and girls are marginalized and have a lot of barriers in accessing services, we assume that they are just experiencing almost no access to services in low and middle income countries. One thing in particular I wanted to mention that we're seeing in some of our work in low and middle income countries with the LGBTQ population in particular is a lot of, especially in adolescent girls and boys, living at home with their parents has really increased conflict and tension around their sexual orientation and gender identity, which has pushed a lot of adolescent girls and boys to being kicked out of their homes, increasing homelessness. We see a lot of violence that these boys and girls are experiencing, in particular LGBTQ boys and girls, adolescent boys and girls. In Peru in particular, we saw a spike in homelessness around LGBTQ adolescents, and we partnered with the government to start a social communication campaign to really help kind of try to change that social norm that underlies and justifies violence against LGBTQ communities in Peru in particular. So really trying to take this moment, which is difficult, to try to give tools and resources to the community to change that norm that incites discrimination, that maintains violence against LGBTQ children and adolescent girls and boys in low and middle income settings. So we did this in several countries, but really responding to an increase in tension at the household that we were seeing. One thing that we have to do, I think, moving forward, and I said that we don't have a lot of data on how, at least that I'm aware of at the World Bank in low and middle income settings, on how the pandemic has impacted women and girls and boys and men of sexual orientation and gender identities that are non-conforming, is because we don't have data, right? And so when we build back better, we really have to make an effort to build back data, to collect data that's not just sex aggregated, which unfortunately still in some countries is not even being done. But we have to encourage all data to be collected in a sex disaggregated way, and having sexual orientation and gender identity also be part of those data collection efforts, so we can really understand in a population-based way how these communities are being affected. Now, in other areas that we're working in, we're really working with Indigenous women, especially here in South America. Their care burden has increased more than it already has. Their limitations on health services, barriers to health services, lack of communication in the communities in local languages. We've seen that a lot, even in countries that recognize themselves as pluri-ethnic and multicultural countries and communities. Getting out the information on the pandemic in the languages already recognized in national constitutions has been problematic. And we understand, you know, this is an unprecedented pandemic, but we have to make an effort to get information into the communities in all the local languages and in the vehicles that women and girls particularly use for transmission of information. So really kind of applying an intersectional lens on how we're responding to the pandemic, how we're approaching our giving of information to different communities, and how we're adapting our health services to the cultural practices of each of the communities that we're responding to. Often we saw that was going out the window. So if we started to make any type of progress on adapting health services in particular to be culturally aware and responsive to the priorities and the traditions of the people that they are meant to serve, in the pandemic, we saw that that was just kind of, this is not a priority right now. We have to give, this very biomedical information out to the communities, not learning from pandemics like Ebola, where we brought in other specialists or community members themselves to help with transmitting that really essential information. So again, learning from other pandemics, we have to have women, we have to have representatives from these different communities in the conversations on how those communities will be reached. Because if not, they are just going to continue to be marginalized, continue to be disadvantaged. And really we can see that this happens quite systematically in countries that are multi-ethnic and plurilinguistic, many of those that we work in low and middle income countries. So those are some of the ways that we've seen this pandemic in particular affect those communities, both the LGBTQ and those women and girls of Indigenous communities that we're working with, and really need to center their voices in the response for those communities.
Thank you so much, Diana. I'll now pass it over to Dr. Moore.
So I think it's probably safe to say that we've all learned so much about how marginalized women and historically discriminated categories of women have been impacted at disproportionate levels during the pandemic. And we found that these women tend to occupy essential jobs that require them to show up for work, as we've been talking about in other answers. And they also have those challenges of dealing with parents and young children. Their income wages are often lower, and they might not have the resources to care for themselves and their families, as we've talked about. And we also see that these individuals tend to live in one home that tends to be smaller than the average home, with more people living there, which makes it easier for COVID-19 to spread throughout the family. And so research is showing some of the impacts of the injustice and discrimination during the pandemic. And one of them is that the systems aren't really meeting their basic needs. And it's great, as we hear from all of the panelists today, some of the creative and innovative ways that these are helping people, but more is still needed. This particular grouping of individuals has gotten more severely sick. And some of the early data that's coming out is showing it's due to lack of access to quality healthcare. And Diana was just talking about the language piece, which is obviously a huge piece. If you don't understand what's being said, how do you know and trust the people trying to tell you that? They oftentimes have higher chronic diseases. Potentially some of that could be from not getting the care that they needed before the pandemic, which of course impacts COVID-19 when you're sick. They also are more likely to die from COVID-19. And I think that one of the quotes that really has stuck with me that I've heard throughout the pandemic comes from Damien Barr, which is, we may be in the same storm, but we're all in different boats. And the boat that we're in impacts how we survive each day. And really what this is showing us is that these long-standing injustices and discrimination and things like social and economic and political and historical inequalities have existed for a long time. And we really need to make those changes, be it with food, housing, water, healthcare, and education. And things that we need to do are really amplify those voices of community organizations and those who are fighting COVID-19. We need to promote more gender balanced and inclusive decision-making to really help support a more equitable, healthy, and resilient community, which really benefits everyone. And we need to make sure that additional resources are allocated to help address these challenges and really provide those opportunities for people to thrive and grow. Another key issue we've talked about is mental health concerns. You really need to reduce the stigma for those to reach out and get access to those services. Supports and resources needed to be provided so that they have that chance to understand what might be happening to them and how those challenges that they're facing are impacting their mental health. They might not even realize that connection from the pandemic to their mental health, and that there are resources out there available to help them. And we really need to create those conditions that allow people to thrive now and in the future. The other thing is that marginalized women have a chronic gap in pay. And they tend, as women in general, tend to earn about 80 cents per the dollar that a man would make. And this particular group of women oftentimes has a more pronounced gap when they're doing the same job. So we all need to help leaders understand how the unconscious mind may be continuing this inequity. And I know that we've talked a lot about unconscious bias. According to PricewaterhouseCoopers, 90% of our decisions are made without even realizing that our biases are impacting the choices that we make. So continued education and professional development in workplaces is really needed to help reduce that unconscious bias and impact at work to help this particular group of individuals.
Thank you, Dr. Moore. Honorable Bennett, you may now give us your answers.
Thank you so much, Nia. And I mean, as we've heard from the previous speakers, there's no question that this has been disproportionately affected in terms of the BIPOC women and trans and LGBTQ2 IA, and it's and it is, I think, you know, as we've heard, it starts with the social determinants of health, as Sandra said, in terms of poverty, housing, education, but it also means that we have disproportionately represented on the frontline workers. And as we've heard and lived here in Ontario, that when there is no paid sick leave, then sometimes it's a very tough decision for people to be able to stay home and for them to still be able to feed their families. In the Indigenous communities, they did very well in the first wave. They were able to lock down their communities and just protect themselves. As the second wave came and things were more opened up by other jurisdictions' policies, the second wave has been quite devastating. And I think one of the things that we know is particularly in the urban settings, but we don't have any data. People have some understanding that that is happening, but in the downtown east side in Vancouver, we are literally operating in the dark. We really don't know even what we don't know. And so, you know, we're grateful for people like Dr. Janet Smiley, the Métis epidemiologist, that is really put together a consortium of people that will try and get us this, because I think that we just can't carry on like this without actually understanding. It's interesting, even in terms of the debate about who gets vaccinated first. We're very grateful that the National Advisory Committee on Immunization put Indigenous people right near the top after long-term care and frontline workers, but it is and wherever they live, meaning including the urban centers. I think what happened over in the spring was, after the death of George Floyd, nobody could deny systemic racism. And I think that really opened up these conversations in all of our institutions. And then with the death of Joyce Echaquan in Atikamekw, in Quebec, it again, that this became like the placards at the Black Lives Matter rallies that said, you know, the system isn't broken, it was built this way. And I think here in Canada, we have the reality. We have two state-sanctioned discriminations, one being slavery and the other being the colonization and this perceived superiority of the European settlers that resulted in the Indian Act and residential schools and all of those really, really racist policies. So I think, you know, after Joyce's death, I had a group of Indigenous physicians that I had been meeting with since last March on Thursday nights. We got together to actually begin and to very quickly put together a conference, you know, a symposium on racism in healthcare, where the leaders, the people with the levers of the colleges and the Accreditation Canada and all of those had to be able to come together and hear the truth of these physicians and nurses, not only for their patients, but for themselves, for what they had in medical school. And I think by actually having to confront systemic racism, we will build back better, because I don't think that conversation is going to go away. And so it is about strengthening diversity and inclusion, but it is about really encouraging and promoting. So in terms of the anti-racism projects, foundations for change, all of those things that Minister Monsef and Minister Chagger are doing. Also the distinct investments in the LGBTQ2 spirited plus the Black Entrepreneur Program, and trying to build a leadership that looks more like Canada. So we know we have to do better, and with the help of all the amazing young leaders on this call, I know we'll get there.
Thank you, Honorable Bennett, for your insights. I'll now pass the question on to Dr. Sriharan.
Thank you. I mean, this is a multi-modal issue. So starting with like what Diana talked about, lack of data, that's a huge problem even in the healthcare sector that I work in. So we normally group everyone into women and men, and that's where most of the data will come in. We don't have more of like a race-based or gender, sexual preferences-based data, right? So there's, even with the COVID-19 and deaths and burnout, we don't have enough data. Like there's estimates of over 25,000 nursing workforce globally have died of COVID-19. But if you look at documented numbers, it's about 7,000. So there's a huge gap in these things. But speaking of that, if you look at the broader data set, 1 in 3 women who died, nursing women who died in the US are Filipino nurses. If you look at from a Canadian perspective, 90% of the healthcare workers who work in long-term care nursing home sector are women of color. So if you kind of from that point of view, you can think about what are some of the implications that women would have been facing. But again, documentation of these things are lacks. Going back into the healthcare workforce generally, so if you look at the US, 12.9% of the US women are Black women, 12.9%. But of the only in the physician workforce, there's only 4.6 Black women are working. So look at the gap in terms of how many Black women are represented in healthcare as physicians. But if you look down in the ladder, I mean, unfortunately, healthcare is a hierarchy, right? So doctors, nurses, and healthcare like support staff. If you look at the healthcare support staff, Black women make up 23% of the workforce. So you can see that it's the same trend with the Latinas, the Asian community. So there's a huge disparities in terms of women and the type of role that women are playing in healthcare environment as well. So this is an issue that we need a systematic approach. Even in Toronto, last year I had a student in my program. She was the only Black medical student in her medical class. Chika, most of you would have known about Chika Oriova. So she was the only Black student at UFT Medical School. But she and the school have made a lot of changes. And this year we have a large representation of Black students in the incoming class. So it's just not only saying, okay, there's a problem and leaving. It's also about saying, how do we address that? How do we change this dialogue? So it's not based on saying that you are from this community and you are from this community. It's about giving all women the equal opportunities, right? We have known from research that women, especially women of color, pay a huge emotional tax when they have to break those glass ceilings and get through systems. There's a recent report from EU that came out that said 87% of the COVID-19 related task force in about 113 task force representing 87 countries, 82% of those task forces are led by men, mostly men. Only 3% of the task forces had gender parity. So huge gaps in terms of decision making, change, innovation. So I think we need to think about not only saying here are the issues or we need more data. We also need to think about how do we change the system so we have equal voices for everyone. Thank you.
Thank you, Dr. Sriharan. I'll now pass it over to Naomi.
So as a lot of the ladies that spoke before me have mentioned, there's a way in which like the patriarchal, racialized systems that we live in replicate. So because the world is ordered in one way, then obviously when disaster strikes, it's going to affect different people differently depending on where it is in their country they live or where it is in the world that they live. And I think, as has been mentioned, there's also the really wide gap that exists between children that live in rich westernized countries and children that have inherited the legacy of colonization. So when school closed, 90% of the world's children were out of school. But for most students, this school closure was temporary. So they had access to really quality distance learning, and their education and their ambitions for the future have continued. But for a lot of other children, the situation is not necessarily the same. So before the pandemic struck, 130 million girls were out of school. And majority of these girls lived in countries that, as I mentioned earlier, have inherited the legacy of colonization. I mean, there's a reason why low and lower middle income countries are low and lower middle income countries. And we can chase that history back and we can find the real source of their economic status. So what we saw when we carried out our rapid response surveys was that there was some learning continuity in homes, and a lot of support that girls were getting were from their parents, which is great because it shows that within the homes there's a commitment to education and there's a commitment to learning. But it also points to something that's really worrying, because even when learning continues, for the most marginalized girls, their parents have lower levels of education. So if they're able to help them, the assistance that they're giving them is not up to par with the assistance that they would receive in school. And for those girls that are not receiving any assistance because their parents are unable to assist them, then what you see is that there's what is called the vicious cycle of poverty. So what happened in the previous generation is happening in the next generation. And so we replicate that underattainment in education. And so these girls that have been marginalized out of no fault of their own, because nobody is marginalized because of anything that they did, are further marginalized. And something else that we see is that girls are always the first to be pulled out of school whenever a crisis happens. And this can be for many reasons. For example, a family might decide to marry off a young girl because it's one less mouth to feed, or because their resources are tight and the extra cattle that are paid means something to the family. Or they may be pulled out of school because they're at home caring for sick relatives, or they might be sent out to work jobs outside of the home to make up for lost family income. And so these girls are more vulnerable to early marriages, they're more vulnerable to teen pregnancy. And so this curtails their ability to choose their future. It kind of makes a decision for them. They are not able to make decisions for themselves. And so again, it just continues to marginalize them further. And basically what we've seen, as all the speakers before me has said, is that the systems that exist have been replicated. And so we do need to build back better. And that has been our rallying cry. This is a chance to rebuild systems as we want them to be. And this is a chance for real change to happen. So yeah, I guess over to the next question.
Thank you so much for such thoughtful answers. Now we'll move on to our third question. So the COVID-19 pandemic has had huge economic and job security implications. In particular,
the pandemic has aggravated pre-existing gender inequalities in the labor force. Additionally, COVID-19 has uniquely impacted rural and urban areas. From your perspective, how has the COVID-19 pandemic impacted women's roles in the workforce? Diana, why don't you start us off?
Thank you, Kelsey, for that question. Well, I mean, this is a really important question, and also where women have experienced huge impacts in terms of the limitations and constraints on their participation in the labor force. More women are employed in informal market sector jobs, and those have been increasingly impacted by restrictive policies associated to COVID-19. So the restriction in mobility has really impacted women who have to move and go out on the street to make their daily subsistence via their participation in informal markets. Their inability to access the resources that they draw from to then transform into their livelihoods has also been impacted a lot with restrictions on mobility, but also restrictions on accessing those resource centers and restrictions that governments have around not everyone every day being able to access. So even if they are allowed to go outside, they can only access certain places on certain days. And this has really limited their access to those goods that they need to procure to continue to engage in the informal markets. And so that is mostly we're seeing in informal areas, in rural areas where women are really risking being sent to jail and kind of have to, for their livelihoods and their daily subsistence, go against some of the policies that have been enacted, putting them more at risk for violence or any type of criminalized penalties. So really risking their lives to make livelihoods and access to markets on a daily basis. And this is both in urban and rural settings. We also see that women that are employed and that have been asked to work remotely and are able to work remotely mostly in urban centers are really dealing with struggling with care work and their potential working from home situation. And we have already spoken on the panel, the lack of care for women who have children at home is really difficult, because what we're seeing is that gender inequality is still alive and well, and men are not kind of equally carrying the burden of care work at home in many of the low and middle income countries that we work. So again, governments are taking this opportunity to put forward campaigns, social norm communication, behavior change communication campaigns to try to help out women and encourage men to share in the care burden at home. But it is a little interesting to see those campaigns being augmented during this time, because it is so acutely affecting women that governments are picking up something that should be an ongoing kind of campaign to change behaviors and attitudes towards equal participation in the home. So that's what we're seeing for women who are able to continue to work from home, just like unbearable care and work burdens, women experiencing burnout, women just working all day at home or in their jobs, their paid jobs and not their non-paid jobs. So working non-paid and paid 24 hours almost. And then we also see that women in the health sector have also been impacted. And I think Sandra and others alluded to this before on kind of some of the closing of some of the healthcare services and the layoffs, particularly affecting women that are the majority of those employed in the care work in the health sector. But also those women in the health sector have also experience increased violence, both in their healthcare settings where they're working, just violence by those who are stressed by having their loved ones, in healthcare facilities that they're not able to access, but also violence when they come home, especially for those who are working with COVID-19 patients, their homes, their spouses not wanting them to come and bring the pandemic or the disease to them. We've experienced some reports of femicide, both in high income, low and middle income countries, of women healthcare workers that are responding to the COVID pandemic, really not feeling safe at home or being asked by their family to live somewhere else. So then, really experiencing homelessness, unless governments are able to step up with alternate housing arrangements for health workers. And we are able to support some of those things where we're taking over hotels and helping governments take over hotels to maintain the safety of female health workers that are experiencing violence in their home. So those are some of the ways that the World Bank has observed that women's participation in the labor force has been impacted. But there are many, many other ways that I'm sure my co-panelists will speak to.
Thanks so much, Diana. Sandra, would you like to go next?
Sure. Earlier, we had talked about some of the numbers of women who have left the workplace in Canada. Last year in the United States, it was nearly 3 million women who dropped out of the workplace. And so when you look at the research around these, they're showing that it is tied to COVID-19, and some of the things that it reflects are the pay inequality, undervalued work, and those antiquated notions of caregiving. So as we come out of the pandemic, and I think that there is some hope and there's some light there that we're holding on to, none of us is really sure how many of these women are planning to re-enter the workplace, and if they'll be able to re-enter at the same level of work and pay as when they left. And so every type of inequality has been exposed and amplified during the pandemic: gender inequality, racial inequality, and income inequality. So COVID-19 has also brought to light that women are also thought of as caregivers. And I think each of the panelists has hit on that throughout the different questions. And what we really need is to create policies around supporting women and families. They need to be updated more as we're learning more and doing things. And I think that we all hope that this is a once in a lifetime pandemic, but we need to focus around lessons and support for caregiving and create these policies to support families. We need to create scaffolding for women to create their professional earning power and take care of their children at the same time. Some of the ways that we could do this is through addressing things like inflexible work policies, sky-high childcare costs, preventing setbacks in gender equity when people get back into the workforce, improving childcare spaces to improve children's learning and increase childcare workers' wages, ensuring that low-wage jobs offer paid leave benefits and sick benefits. And this particular group often has mothers who have additional caretaking responsibilities in addition to the jobs that they hold. Greater enforcement around equal pay laws, really helping to protect against wage discrimination, and corrective measures to be taken in specific low-paid industries to increase wages in those industries. There's a large effort here. And thanks to COVID, it's helping us focus around diversity, equity, and inclusion efforts that ultimately can better support women throughout their life's journey. These efforts aren't new, and they've been around for many years. But given the increased focus and direction, they help address gender imbalance and help to cultivate women in leadership roles. As students and future leaders, I recommend that you get involved in mentoring programs, continuing your leadership development, and looking for ways to create healthy work and life supports for you and those you work with. We all need to work together to push through the glass ceilings to improve workplace participation, earning potential, public office representation, educational attainment, and health outcomes. Without equity, we cannot end pandemics. Inequity itself is a pandemic and should be a priority at the national and global levels, where measures like tax reforms and investments are made to deal with these challenges.
Thank you for that, Sandra. I'll pass it on to Carolyn now.
Thank you so much, Kelsey. And yes, I think what Sandra just said, I think is what all of us know, that inequity is a pandemic and that we have to build back better, addressing that in the forefront. I think if Minister Monsef was here, because she's also the Minister for Gender Equality and Rural, that she'd probably start with the absolutely inequity in terms of access to high-speed internet, in this big, huge country of ours, it really is been very difficult for people to participate at a distance, whether it's their education or health appointments or all of the things that have been made so much more difficult because of COVID, including when everybody's working from home. If you don't have decent internet, that becomes even more. And so that has become a real focus to get this job done, to get it equitable across the country. And I think for years we've heard from particularly Indigenous women and rural women that even around their safety, that if there isn't cell coverage, that they are at greater risk, as we have learned in the Highway of Tears and so many other areas of Canada. It is as everyone said, that women have faced the huge job losses and reduction of hours, and with the together with the unpaid care work at home. And it is about us just being intentional about not rolling anything back in terms of where we've gone on the path or the journey of gender equality and empowerment. And so it is going to have to be intentional, that we keep track. And as I think in the numbers in September, where for the number of mothers who worked less than half of their usual hours for reasons most likely COVID, it was 70% higher than in February, as opposed to men or fathers being 24% higher. So, I think that we also have learned that some of the health policies that should have been fixed a long time ago, like the PSWs or health workers being able to work in more than one institution, that we actually have to make sure that when they were told they could only go to one institution, they then lost the work in the other institution. So as we move forward with the emergency childcare that was there for the health workers, as we move forward in just finally a national early learning and childcare system, we actually will have to keep going. But at least now we have a Gender Budgeting Act that means that we have to have a gender results framework to address this. And so we'll just keep going.
Thank you, Dr. Bennett.
Thank you. Yeah, we'll move on to Abby.
Thank you. See, the women in healthcare, particularly, that's the area that I study, are leaving healthcare workforce for 3 reasons, right? And it's based on the age groups. So younger women are leaving because of feeling social isolation. They are, due to social distancing and everything, they are working in high stress environment like healthcare, and then they are coming home and they are isolated from everyone else. And that's causing people to second guess whether they need to continue to work in healthcare, they need to think about career changes. The women who are in their mid-career, with mostly mothers, they are leaving the workforce for the reasons other panelists have talked about. Childcare responsibilities, family responsibilities, especially the sandwich generation who have children and parent responsibilities. They are leaving workforce for that reason. And then older women are retiring from healthcare workforce early, again, because of unexpected workload that they are facing in healthcare frontlines. Partly because they, in teams, when people get COVID-19 and then they have to reassign jobs. So your standard workload at work is double fold, triple fold because of workforce shortages. And then you are working in these long shifts and then you're coming home. And then you have, like Dr. Bennett talked about, increased workload at home as well because of childcare responsibilities and other responsibilities. So there is very little time for rest and restoration. People can go for a period, but how long can they continue to take on? I'm seeing a lot of physicians, nurses transitioning jobs from urban settings to rural settings just because the workload is not as demanding as this is. People are putting work-life balance as one of the values that they're looking at. I was teaching a course last week for a group of medical students, and I asked them to identify 5 of their values, key values. Work-life balance came as first thing. There was 15 medical students in that group. All 15 of them identified work-life balance as kind of their top priority. So look at that. So the generation is looking for that, and our system is not prepared to give that option, right? We even though on paper we expect 80-hour work week for our residents and early trainees, that's not what they do. They have work hours with patients, and then they have paperwork, the EMRs, their documentations, and all the things that they have to do behind the scenes. So this whole burnout factor in healthcare is an issue that happened before COVID-19. The COVID-19 is just giving us a little bit more insight into what's going on. But if we don't address that now, we are going to run into a huge healthcare crisis without the right healthcare infrastructure. So it's time for the systems to really think about health workforce and think about what we need to have in order to face the changing healthcare environment. Thank you.
Thank you for your response, Abby. And I'll pass it on to Naomi now.
Great. So estimates show that women's jobs are 1.8 times more vulnerable to this crisis than men's jobs. And this is, to put this in perspective, women make up 39% of global employment in the world, but they accounted for 54% of overall job losses. And I think that those statistics say enough about how disproportionate the impact has been on women in the workforce. So there are many reasons for this, and reasons that have been touched on by all the speakers before me, but I'll just go through them again. So first is the labor market dynamics. So all around the world, it doesn't matter whether it's a mature economy or if it's an emerging economy, the nature of work remains very gender specific, with women and men clustering in different occupations, which has gender implications during the pandemic. So for example, when there were international travel restrictions and there were supply chains, this curtailed women's ability to trade. So there's a really large share of women in the manufacturing sector, such as textiles, footwear, and apparel. And these sectors saw the largest falls in export growth. There's also a large number of women that work in services that were affected by travel restrictions. There's a large number of women, as I mentioned earlier, at the front lines of education. There's a large number of women at the front lines of healthcare. And so at the front lines of education where schools were closed, and there's a large number of women at the front lines of healthcare that are facing the challenges that both Abby and Sandra have spoken about. And so something that we're doing at Malala Fund is we're working to challenge, as I said earlier, the systems, policies, and practices so that girls can get an education and so that they can choose. And when girls can choose, there's a diversification in the workforce. And so then women are able to go into more job secure labor markets. And in that way, perhaps in the future, they won't be as affected by pandemics. The second reason, which has also been touched on, is the care economy. And there's a burden of unpaid care, which falls on women, and the demands have grown substantially during the pandemic. So all over the world, women are doing 75% of total unpaid care work. And in some regions, such as like Middle East and Northern Africa, this is as high as 80 to 90%. And there is a significant negative relationship between the amount of unpaid care work that a person is doing and their participation in technical jobs and their ability to assume leadership roles. So since women are spending more time on family responsibilities, then it goes without saying that they are unable to participate in employment. There are estimates that women in the United States have been spending 1.5 to 2 hours more on unpaid care responsibilities. And in India, they've been spending 30% more time. And another impact that the crisis has had on women's participation in the labor force, especially in low and lower middle income economies, where the majority of women's participation in the economy is through micro enterprises, is the fact that there's scarce resources within the family. So there's no money to invest in this micro enterprise that this woman is running from outside her home or from her neighbor's kiosk. There's no money for her to continue to grow her business. If, for example, a woman is using a digital device to run her business, this digital device is now being shared with the child whose learning has gone online. And all these factors are not separate to each other. So for example, a woman who runs a micro enterprise from the home also now has to take on increased care responsibilities. So she's unable to run her business as she would have been able to previously. I think the World Trade Organization carried out a survey to try and find out what kinds of policies it is that women would like to see. And what they found was that female business owners who are married with young children reported that their top priority for policy was support taking care of household members, whereas for men in the exact same group, this only ranked as 6th. So it really shows the kind of support that women need going forward. And it also shows how it is that women have been impacted by the pandemic.
Perfect. Thank you so much, everybody. This has been such an insightful conversation. Believe it or not, we have actually reached the last question of our panel, and that one is, over the past year, we have been said to be experiencing 2 pandemics, the COVID-19 pandemic and the shadow pandemic of gender-based violence. Why are the current policies in place failing to adequately address such a critical issue? And what can we do to fix these policies? Diana, the floor is yours.
Thank you, Angelina, for that question. I mean, this is a huge question. We no doubt know that during the COVID-19 pandemic, there has been an increase in violence that women and girls have experienced, both inside the home and outside the home, but more in particular inside the home. Usually intimate partner violence, but we're also seeing a lot of sexual violence around perpetrated against adolescent girls. And, you know, the policies that we had in place pre-pandemic were also failing these women and girls. I mean, especially in low and middle income countries, there's rampant impunity. There's little to no access to quality services. And even in countries where we see large proportions of budgets being placed in policies and programming meant to address gender-based violence, we're seeing some unfortunate interventions being adopted that are not evidence-based, that are not negotiated or consulted with the community, that do not include the voices of women. And so this has just continued to occur with a larger proportion of women and girls experiencing violence and a restriction in the services that they need to access, right? We've also seen an increase in female genital mutilation. And we know from past pandemics, like was said by Naomi from the Malala Fund, that girls that are not going to school might not return. We see an increase in early and forced child marriage. So the pandemic of gender-based violence, violence against women and girls is absolutely going to outlast the COVID-19 pandemic. It was there many, many years before the COVID-19 pandemic. It's good that we're able to now shine a light on this co-occurring pandemic. It's been a pandemic in the shadows too long, and it's time for us to pull it out of the shadows and really place it at the level of pandemic and give it a response, a multi-sectoral response, like should be given to the COVID-19 pandemic, like what is being given to the COVID-19 pandemic, to the pandemic of violence against women and girls across all settings, high, low, and middle income settings. The lack of access to justice for women and girls, the lack of access to livelihood opportunities for women who choose to leave their perpetrators, to be able to actually do that sustainably, the lack of shelters for women to flee moments where they know that they're at risk of being murdered by their abuser. I mean, really enforcing, I live in the US, even though I'm in Colombia now and I'm Colombian, restricting guns and really implementing and enforcing those policies. What we see is, the World Bank tracks a lot of policies related to violence against women through Women, Business, and the Law. And I'll drop the link in the chat after I'm done. And we track policies on sexual violence, from strangers, sexual violence in marital relationships, early marriage, and sexual harassment in the workplace. We see that more and more countries are coming on with policies. However, implementation is low to none. Really, I mean, having governments struggle with the implementation of this work and struggling with balancing prevention efforts, which are needed to change the norms and attitudes that underlie the use of violence and lead to its acceptability and a way to maintain gender inequality. So we need to prevent those and change those with behavior change communications, addressing those harmful norms. But we also need response. And we're having governments having trouble balancing how much do you invest in prevention? How much do you invest in response? We're also seeing, like I said, some non-evidence-based interventions being taken up that might not be sustainable. So in not many countries can sustain standalone what is called one-stop shops, where women who have experienced violence go to receive services, right? We need a woman to be able to go to any health center, primary, secondary, or tertiary, and be able to at least get a referral to where they can receive a quality service. We don't need to build a whole separate structure to have a health service that should be their right to begin with through the health, public health systems in countries. Again, we need women to be able to go to police stations where within even the police station, there could be a women's desk, but not building a whole new police station just for crimes around violence against women and girls, recognizing the stigma that this carries. So it really is such a great opportunity during the COVID-19 pandemic to highlight the pandemic of gender-based violence globally and to really highlight how the policies in place were already not enough and how they have to be implemented if they're going to be written, how they have to be monitored, how they have to be financed. We need to track the funding, both for prevention and response programming. So it is a pandemic. It's going to affect, 1 out of 3 women on this call. There's so many of you. And we need every one of you who does experience some type of gender-based violence to know exactly what your rights are, exactly who can help you, and how to access the care that you need to move forward in your path of healing from the incident that you'll experience. And hopefully work together with all of you on the phone, to change those harmful norms, to change the acceptability, to change the stigma around experiencing violence, to really speak up and say, I'm a survivor, I needed this, advocate together for the needs of all survivors of gender-based violence.
Thank you so much. Sandra, would you like to go?
Dana, I really loved how you talked about sort of re-envisioning how we provide help and how we provide resources, because I think that that's the piece, especially with this. We know that violence has been occurring forever. Now it's just changed a little bit. And then how do we potentially make changes to have a much longer impact long after the pandemic ends? I think it's also important to say that violence can happen to any gender. It's not just women. And I know we're talking about women here, but women tend to be impacted at a higher rate than men. And things have gotten worse during the pandemic, and we've talked about lots of potential things, like most likely due to a stay-at-home or shelter-in-place order. Safety, it's hard when you can't get away. I think of all of us, we've probably spent a lot more time in our home unit, whatever that looks like, right? And so if you're not in a safe place, it becomes very difficult. And many of you have probably taken an introduction to psychology course and heard about Maslow's hierarchy of needs. And loss of safety and security really stops everything else from happening that's higher level above that. And not being able to get away to a space of safety. When we talk about schools and understanding it's much more than education, that they provide food and socialization, but you think about all those other safe spaces like libraries or public spaces that people can go to get away from environments where they might not feel so safe. The other piece is that services weren't open to women at the beginning of the pandemic. Everything got closed down quickly, and we've learned how to adapt. And when we think about what is it that women need for access to services with violence support, really court-ordered protection services. And things have done a great job of transitioning to things like virtual hearings. But what happens if you don't have internet to connect to one of those hearings? That causes a different problem. The medical and psychological support. Male or female, it can be very hard to go out and say that you're being abused and you need help. Having legal aid, especially if you don't have any resources to be able to do these things. Hotlines to figure out what it is you need to do. I mean, if something were to happen to you, would you know what steps to take today? Shelters and housing. When you think about when things were shut down, at least in the States, a lot of the shelters and housing were not available. They've since adapted and have come to find ways of supporting these individuals. They've also looked at ways of providing housing benefits or resources to those who are in need in getting them. Giving them financial assistance. It's hard to leave if you don't have resources. And then trying to really utilize technology like social media and apps to help people connect with these resources. And prevention is really important to think about moving forward. We obviously want to deal with whatever violence is going on and make it safe for people to come forward. But things like training healthcare providers, how do you help prevent and better support women through these challenges? I know that they want to do that, but given everything that they're expected to do, how can they do that? How do we create laws and policies to better deal with these challenges? Really studying further through research and understanding what interventions and supports work. Because if something's not working, our funding better utilized somewhere else. And then as women, we need advocacy to really stand behind and champion ideas. And together with a variety of sources, we can help create the change that we want to see. And these are benefits, being the right thing to do for people. We need to help people with this. And it also, as a benefit to society, allows women to then participate in those economical, social, and political spheres. And as vaccines are rolling out, again, not equally to everyone, but they are coming out, I really hope that 2021 brings us closer to the end of the COVID-19 pandemic and our lives transition into a better normal, where we have that ability to work together to build that fairer, more inclusive, and sustainable society.
Perfect. Honorable Bennett, would you like to go?
Thank you, Angelina. And this is really so important as I have the responsibility for responding to the first ever national public inquiry on missing and murdered Indigenous women and girls, which means that all the provinces and territories, as well as Indigenous governments, have to respond together in a coherent way. And I think this is, in some ways, that just hasn't been happening. And that whether it's us not listening to the families and survivors to have them at the center of any planning going forward. And so Thursday night, they found the body of Jana Williams, 29-year-old, pregnant in Winnipeg. The hashtag there was, "It just never stops." And I think that the families want us to do better, but they want us to listen to them as to what they believe would be necessary in terms of not only the justice and the healing, but to put in place the concrete actions so no other family has to go through this. And so as the National Inquiry report came out, it really was about that holistic all of government approach that means health, justice, security, culture. It has to be trauma informed. And I think that's what I heard during the pre-inquiry hearings, gatherings, was that the influence of child abuse or attachment to the child welfare system, that there was a whole problem that was clear for not only the victims, but also the perpetrators. What they taught me was hurt people hurt people. And that's why a lot of the Indigenous communities are wanting programs for men and boys, that when you had abuse, then you have this kind of shame and anger that numbs itself out with drugs and alcohol, that then leads to violence, suicide, incarceration, that we actually have to be able to prevent in order to reduce this national tragedy, we have to also deal with the causes and the causes of the causes. This won't be a Band-Aid. This has got to be everything across all jurisdictions. Very interesting that this empowerment of women piece is really what the name of that report was called, Reclaiming Power and Place. And it was interesting, over Christmas, I learned that it was the Haudenosaunee women who actually taught the first wave of feminism in North America about what inclusive decision making would look like and how you have to listen. So I'm pleased that Minister Monsef is working with us to take not only what will be in the National Action Plan for Missing and Murdered Indigenous Women into this first ever federal strategy to prevent gender-based violence that will be inclusive and holistic and be able to learn, because I think that was why the question was so good, because you've asked us, how come everything we've ever done till now isn't working? So let's actually figure it out. And that starts by talking to the families and the survivors who know what needs to happen.
Thank you so much. As a resident of Winnipeg, that really hit close to home. And Dr. Abby, it is your turn.
All the things Diana, Sandra, and Caroline talked about resonates with healthcare workers as well. I wanted to bring a different angle to the violence that healthcare workers are facing in their workplace. And it's when you talk about workplace inside and outside, right? And the COVID-19 has highlighted in countries like India, China, Philippines, Turkey, UK, that healthcare workers are facing violence by the public. Just because they are working in the healthcare sector, there's an assumption that they are spreading COVID-19. So there's a lot of stigmatization, verbal abuses, isolation, all happening. Even in early mid to 2020, World Medical Association has to put out a call to say they need to stop the violence against healthcare workers. They are not responsible for the spread of COVID-19. And then if you look at workplace inside, there's a lot going on, whether it's from the patients or other health professionals. Partly mostly verbal abuses, but also things like sexual harassments, non-physical violences around shouting, bullying, threatening, all of those kind of things happening. Just if you think of step back and think about why the work-related violence is happening in the healthcare workforce. When we talk about healthcare, people only see the frontline healthcare workers. They don't really understand the big system that's behind them. So when a physician, a nurse, a healthcare professional go to the patients and say, we can't provide you with this care, or we can't let you go in and see your patient, family members because of current COVID-19, the person who's going to face the wrath and like the arguments is the frontline healthcare worker, right? It's not the system behind it. So they are kind of the people who are in the middle of everything, and that's causing a lot of challenges. So in terms of the questions around what can we do, better education, a public education to understand the complexities of healthcare. So it's not your family physician who's not giving you vaccines. The vaccines, there's a process in terms of having access to vaccines. Or it's not your emergency physician who says, I can't admit you into the hospital. You need to go home. It's the system that puts in place. The emergency physician may be doing the screening and deciding on the triaging, but hospital beds, it's decided by the system. So there's that people behind these frontline healthcare workers that's also deciding on things, and patients need to see that. Similarly, in workplace culture, like I said earlier, healthcare, there's hierarchy, and there's also gender differences and expectations. I have heard a lot from my female healthcare colleagues. They would walk into the room with a male trainee, and oftentimes the physicians, the patients would turn to the male trainee instead of the attending physician who might be a woman. Just because there's an expectation, if you're a doctor, you're male, and if you're a woman, you're most likely a nurse or a support staff. And how many times they are being addressing Dr. so-and-so for the male colleague and saying Abby or Sandra or Naomi for the female physician, just because they are women. There's all sorts of gender discrimination, gender differences, gender treatment in the healthcare sector, and mostly by patients. And it's because there's lack of understanding and awareness about the complexity of the healthcare workforce. So I think what we can do to change is really informing the population about these things. Thank you.
Thank you so much. And last but not least, Naomi, take it away.
So thank you so much, Abby, for your thoughtful responses. There's a statistic which I love statistics. So the UNFPA estimates that globally, domestic violence is going to increase by 15 million additional cases for every 3 months of continued movement restrictions and stay-at-home orders. 15 million additional cases globally for every 3 months that women's movement is restricted. And I think that that's just, it's really jarring. And so it's evident that a lot needs to be done in order to fix policies that are addressing this very critical issue. So Diana talked about having like implementing solutions that are not necessarily evidence-based. And I think that refers to the fact that there's no evidence to the fact that this solution that has been put in place works. But I think that in a lot of countries, there's also the need to collect data systemically and periodically that shows the prevalence of violence against women, because that data lacks in a lot of places. And so it's not necessarily the need to build a new agency to collect this data, but perhaps there can be more coordinated efforts by national statistics institutions to collect reliable data so that any policies and proposed legislations that are made really meet the needs of the society within which these policies are being made. Another thing that would help with this crisis is having strengthened political leadership. In a lot of countries, there's a lack of political leadership around the mechanisms that are put in place for the advancement of women. And so it makes it really difficult to reach any political agreements. It makes it difficult to negotiate any additional budgetary resources. And it makes it really hard to address the very patriarchal and violent cultural resistances that are anchored within the very structure of the state. And so strengthened political leadership would help move this forward and would help make this a priority in a lot of low and lower middle income countries. And this goes hand in hand with additional budgetary resources to implement the policies and plans, because it's really difficult to do anything without capital behind it. And lastly, another solution would be to ensure that there's continuity of policies and plans in order to limit fragmented institutional responses, where the responses depend on which party is in place. It depends on whether this is important politically, if it fits the party's political profile, if it fits their ideological profile, and then whenever a new party gets into power, then this is something that's pushed to the wayside. So this needs to be something that gets embedded into systems, something that's elevated to state policy, something that has a constitutional status to ensure that responses are not fragmented over a period of time, because lasting change can't happen in 2 years. It can't happen in 3 years. It has to be something that happens over a really long period of time. Something that happens with sustainability of policies and sustainability of programs. So, yeah.
Thank you so much. Wow, what an insightful discussion and panel this has been. Thank you all for your thoughtful responses. I'm mind blown. We really appreciate that each of you not only address the issue at hand, but provide tangible solutions and actions moving forward. So thank you all for your excellent responses. We'll now announce the raffle winners, followed by announcement about a reflection form, and then we'll take a brief 10-minute intermission prior to our Q&A period. So over to you, Melissa, for the raffle announcement.
Thank you, Maggie. So our raffle is now closed, and we would just like to thank you all so much for contributing to it. 100% of the contributions made will go towards women's health in women's hands. Now we would like to congratulate our 3 winners, who are Janet Lynn Elamar, Bianca Bacone, and Mira Azar. So please email UN Women UFT. We will post the email in the chat box, so we can figure out a way to send you your virtual gift cards to Badge and Boo. You are all so amazing for merely attending our event and wanting to educate yourselves on these perilous issues that require our immediate attention. But by donating, volunteering, and giving back to organizations that actively work to address the issues that we've been discussing are just a few ways that you can take the next step on what you've learned here today. Awareness does and should bring about affirmative action. Now I'll pass the floor over to Angelina from UN Women UFT, who will be discussing our reflection forum.
That was beautiful, Melissa. Thank you so much. I would firstly like to thank all of our panelists for speaking with us today. The work that you are doing to address and close the gender equality gap in your respective fields is truly awe-inspiring. I am mind blown just as much as Maggie is. However, I would also like to thank everyone in the audience today. Like Melissa said, by being here today, you are helping to spread the conversation on the future of gender equality issues post-pandemic, and which is an incredibly important first step forward to closing that gap. So thank you. Our incredible moderator, Maggie, mentioned that this event is the first student-run, female-ran virtual event of this scale and magnitude. And because of that, we would love to hear your feedback on the discussions that have been facilitated today. So in the chat, we're going to drop a Google form that has a short list of questions that will allow you to reflect on what we've been talking about today, as well as provide feedback so that we can better facilitate conversations surrounding this discourse in the future. Thank you everyone again so much, and back to Maggie.
Excellent. Thank you so much, Angelina, and thank you to everybody. We're not finished yet, so we will do the intermission now. So feel free to turn off your cameras and your mics. We'll have a slide put up that says intermission. We'll be back in 10 minutes, so roughly around 4:17, 4:20 p.m. Eastern Standard Time. Great. So we'll see you all in 10 minutes, and then we'll get into our Q&A period and conclusion. Thank you. Excellent. So welcome back from the break. We're now entering into our live Q&A session of today's panel discussion. Members of the audience, if you have any questions for our panelists today, please feel free to type them in the chat. I will read them out loud to our panelists and they'll do their best to respond. But first, some quick Q&A etiquette. If you are gearing a certain question towards a certain panelist, please put their name in the question just so they're aware. Lastly, just so everyone is aware of this Q&A period will be around 20 minutes. And once you post your question in the chat, I'll personally read them out to the panel. All of that being said, let's begin. You may now begin entering your questions. An audience member has specifically asked to ask a question orally. So audience member Geneva, you may start us off and then we'll follow up with questions from the chat function. Thank you.
Thank you so much. So good evening. My name is Ginevra. I'm a journalism student in Lille, France. And I'm actually working on a report with my Instagram media that is called Fast Info that I invite you to check out. And it's about menstrual, so period precariousness during COVID. And since I saw this event online, I thought about participating. So thank you so much for your work. I'm in complete awe. Therefore, I would like to know if it was possible to raise this issue and ask the speakers what's the situation in Canada or in the country of or in their country of belonging and their opinion on the matter. Thank you.
Geneva, are you asking this question specifically to a panelist, or would you like it to be open to the floor of panelists?
I would like it to be open if it's possible. Thank you.
All right, excellent. Thank you for your question. Maybe for the sake of time, we'll go in the same order as our panel responses. Also, just note that Dr. Abby had to step out, so she's not with us anymore, but the rest of our panelists will be able to answer your question. Diana, do you want to start us off?
I think Dr. Abby's here, and also she got back probably before I did, so I missed the question. I'm so sorry.
Do you want me to ask it again?
I'll just listen in and then maybe.
Sorry?
You can maybe move on to the next panelist and then I'll come back at the end if that's okay.
Yeah, sure.
Thanks.
So I think it's a very good question. I mean, I'm not sure that I have that much information to be able to provide you a good answer with this one. I'm not sure if any of our other, it looks like Abby might actually have something.
Sorry, I actually missed the question too. I didn't put my headphone. I was thinking that I was online and I forgot to put this. So if you can repeat the question, we'll try to get.
Of course I can repeat. So I was saying that I'm a student, I'm a journalist in France, and I'm actually working on a report that is about period precariousness that is a big issue and topic during COVID crisis. So I wanted to ask to the members that are here today, what's the situation in their country of belonging and their opinion on the matter?
So maybe I can go first. Yeah. Period poverty it's a very real thing, especially with the girls living in the communities that we work in. So from the country where I'm from Kenya originally, and in 2019, in late 2019, there's a girl that actually committed suicide. She killed herself because her period started when she was in school and teachers and other students made fun of her. And so she went home at lunchtime and her mom couldn't find her. And when she found her dead. So I think there's a lot of, as we would say, we need to normalize periods, like it's a thing that happens. And so there's also a lot of harmful gender norms, a lot of harmful stereotypes around a period being something that's dirty. But around period poverty, there's a lot of countries that have a lot of high taxes on menstrual hygiene products. And so there's also the need for other products that are also more sustainable and better for the environment. And there's a lot of work that's being done to teach girls to make sanitary products that they can clean and reuse so that they can go to school. Because when a girl is on her period and she's unable to keep herself clean, then she stays at home. She doesn't leave to go to school because she needs to bleed out somewhere that is safe. When a girl is on her period and there are no wash facilities in school, that's like water sanitation and hygiene, then she's also unable to go to school because she's not able to clean herself up in school. And so it really interrupts learning. And that's another way that the gap between the haves and the have-nots is widened because of this thing that happens almost every month that girls have no control over. And it's great to see that some countries are taking the step to zero rate period products, but there's a lot more that needs to be done in that area.
Absolutely. Thank you so much, Naomi. And I know a personal resource of this is Bleed the North. I can put that in the chat, but they work to fight against period poverty in Canada. Absolutely a great resource for you, Generva. Do any of our other panelists want to do a response to her question before we move to the next one? Okay, excellent. Thank you, everybody. I know that Ali Dunn, a member of the audience, also wants to ask a question directly too. So over to you, Ali.
Hi, thank you all for being here today. I found the discussion to be very interesting. My question is for Diana. Diana, you mentioned the importance of expanding gender-sensitive data collection to help close information gaps, and you also highlighted the lack of service available to survivors of gender-based violence in rural communities. So my question for you is, what role do you believe technological innovation will play in reaching those women and collecting that data?
Great, thanks for that question. That's such a great question. So for data collection, I think technology is going to play an essential role. And I really kind of think in data in two buckets, and kind of looking at prevalence data so we understand the magnitude of issues of exclusion, of issues of violence. We have, I think, over, I'm gonna say it's 119 countries now with prevalence data that's population-based on intimate partner violence and sexual violence, but we need data on other areas of gender-based violence in particular. But data on LGBT communities is lacking. And so we need those at the prevalence level. And that is really through national statistical institutions that are using technology more and more to roll out kind of their large data collection efforts. But then I think there's another role for data, not only in data collection, but also in that service piece that you mentioned. And we're working with really innovative local grassroots organizations that are leading the way and teaching us how they're using data to kind of close that gap in services. So for example, in Brazil, we have a really great partnership with NUSAS, and I can drop some links in the chat, that is mapping psychosocial support personnel, so therapists or licensed social workers, and lawyers that are willing to give free assistance to survivors of gender-based violence in a community, right? And so really they sign up, they take some courses, there's some kind of technology enabled kind of vetting of these professionals to make sure that they are not going to further victimize or traumatize the survivors. But once they pass this, they become kind of a pool of service providers, pro bono service providers that in Brazil, they work in Brazil, they can map even to the most remote areas, someone who's the closest lawyer to you that can help you file a protection order, follow up on something, etc. So that's super cool because they're doing this all through technology. The person that's leading this is based in Rio, but this is, again, Brazil is a huge country. So this is a Brazil level kind of technology app that's providing, is closing the gap in psychosocial support and legal support for women across Brazil with lawyers, with psychosocial support personnel that might not do this as the full-time job, but really want to give of their time to support women survivors of violence, right? So that's great. In Armenia and Georgia, we have another partnership with an app called SafeU. And SafeU is also helping us not just map out who the services providers are in Armenia, but also helping us track hotspots for unsafe places around Georgia and Armenia, and also track the quality of service providers, right? So you can give feedback and kind of rate service providers on this app. And that becomes a resource for women that want to go seek the service and don't want to be re-stigmatized, don't want to be rejected, don't want to be marginalized because they're trans women. And then so they can kind of review the services on there, but it's really specifically around services for gender-based violence. So I think technology has a huge role to play, both in allowing us to collect better data, but also in closing some of these service gaps, like I think you were alluding to, Ali. So thank you for those questions. And I'm happy to drop some more links into the chat on this topic.
Thank you so much, Diana. And before we move to our next point, I saw Carolyn Bennett put into the chat. She said, I'd love to hear from Diana, women-only police stations in South America and the women's desk that you had mentioned previously.
Sure, thanks for that question. So a beautiful study was done in Nicaragua after a population-based survey was conducted in 2 of the states in Nicaragua, measuring the prevalence of violence against women about 25 years ago. And what they found 25 years ago was that 1 out of every 2 women in Nicaragua were experiencing intimate partner violence or sexual violence by a non-partner. And if you want to look at that study, it's called Candies in Hell. And it was conducted by Mary Ellsberg, very much a leader in the violence against women field and a mentor of mine and a wonderful human being. So she went, and after her study, a landmark study, the government of Nicaragua really stepped up. And one of the things that they did was having these female-headed police stations within police stations, but really where women could talk to a woman officer and could get the help they need. Now, Nicaragua enacted several different policy measures. They improved their health systems. They had campaigns, laws, you know, around gender-based violence. And the beautiful part is that those female-run police desks within the normal police stations were part of this kind of multi-sectoral strategy that Mary Ellsberg was able to then come in 25 years after her initial study and kind of replicate 25 years after the fact to see if this myriad of policies had actually reduced the prevalence of violence against women and girls. And what she saw was that it had reduced, right? So now it's not 1 out of 2 women. I think it's more 1 out of 7. I don't have the most recent studies. They were just published in a journal article. I can also send or drop in the link. But what the story is that there has been a reduction in violence and that those women police desks were part of that story. Now, it's not the only intervention. And one thing that we have to think about when we're addressing violence against women and girls, it's not like ever going to be a magic bullet. It's every sector has a role to play, right? It's the police, it's the health, it's even energy sector, transport. At the World Bank, we work in every sector that we work on to see how can your sector play a role in reducing violence against women. So we have in Ethiopia, the energy sector has this massive campaign with their workers on kind of addressing sexual harassment in the workplace, but also intimate partner violence in home, and kind of giving those messages within their institution, their Ministry of Energy, that that is not okay, and that the people that work in the ministry should not be violent against their wives. So if we really saturate communities with messaging from different sources, right? From their workplace, from the community, from, you know, in Latin America, novelas, from your neighbors, from your church groups, and all have these messages that violence against women and girls isn't acceptable, and that if you experience it, you shouldn't feel stigmatized or marginalized, that there is help, then we feel, and we saw in Nicaragua, that change can happen. So that's where kind of the police helped us. That's a long answer to that question, sorry.
Oh, that's excellent. Thank you so much, Diana. We have a few other audience questions that we'll try to get through. Olivia, would you like to go next?
Yes, thank you for all your discussion. So my question is also related to the first question that got asked. It's about period poverty and the stigma around it. So in the early months of the pandemic, the Chinese government mobilized larger numbers of female medical workers to support the effort in the epicenter of Wuhan. And one thing that was ignored, although it is a basic human right, is the access to basic sanitation and menstruation products of the female medical workers. So I wonder, in the Canadian response of emergency response, such as an emergency rescue or support in the aftermath of a hurricane, for example, how do the Canadian authorities ensure that every female medical worker and frontline workers have the access to menstruation products? And how can we help with the situation of menstruation poverty? Thank you.
Great, thank you so much, Olivia. If any of our panelists want to step in and begin their responses, we just have one question after this, so go ahead.
Sure, I could take the first stab. So we haven't really seen this as an emerging theme in the Canadian context, even though we have seen it in the other countries. One is the hospitals do have call rooms and spaces available for healthcare workers. There's also most of the washrooms in the hospitals do have access to sanitary products and things. So it hasn't come up as a major issue. However, healthcare workers have said lack of space for them to rest, eat, all of those things have caused a lot of burden. So from a Canadian perspective, it hasn't come up on the top.
Great, thank you for that response, Dr. Abby. Do any of our other panelists have a response for Olivia's question?
I just think that in what was a plan on Nutrition North going north, that there was in terms of food subsidies, that certainly there was has been an effort to include the sanitary products as part of something that ought to be subsidized. But it's an excellent question, and I'm gonna ask, find out more.
That's great. Thank you so much. And definitely, I know I feel biased because I personally know a lot of us know the founder of Bleed the North, but they really are doing excellent work exactly on this topic. So Olivia, I would gear you towards Bleed the North. Okay, excellent. We're going to move on to we only have time for one last question, and it'll be from Melissa. So Melissa, if you'd like to ask the question, and then we'll wrap up for today.
Thanks so much, Maggie. And thank you all so much for your responses. Diana, your earlier response kind of makes me think about how the feminist movement is very different when you approach it from the global north and the global south. So thank you for your insights. So my question is primarily for you, Carolyn, but if anyone else would like to chime in, I'd love to hear your thoughts as well on this issue. So you mentioned earlier that the Canadian government has launched a national inquiry into the missing and murdered Indigenous women and girls. With that said, what other approaches do you recommend that the government and we as civilians can take to bring about more effective change to the issue at hand, keeping in mind that the COVID-19 pandemic has perpetuated this national crisis?
Thanks for the question. And again, I think that the National Inquiry has forced all governments to actually break down the silos and work across governments. And so I don't think I've ever seen, meetings where all the deputy ministers are there. Everybody knows that they are part of this. And just as Diana said, that whether it's transportation, whether it, there's some key ministries involved, but we actually, and also breaking down the silos in the jurisdiction. So I think that again, it's a matter of, if you put the families and survivors at the center of the work, then you can't say that's not my department, or that's provincial, or we actually have to respond to the inquiry in a holistic way. And I think what we've done, in having the families and survivors at the center of the work has meant that there were areas that we needed to do a better job at identifying wise practices, identifying what's working in terms of a strength-based approach to this. The family liaison units in all the victim services across the country have been doing a really good job navigating families and survivors to help. But I think that as we go forward, it's now over, I think, 100 Indigenous women leading this work now in the subcommittees, coming to the core committee, a separate core committee on two-spirited and gender diverse, a separate working group on urban, of course, the distinctions-based group, First Nations, Inuit, Métis, and then the one that, of course, my favorite group is data, because we actually have to know whether we're winning or not on the outcomes, but the causes and the causes of the causes. So how do we make sure that we're measuring what matters? And then I think what we are learning is if we could get this right, we might be able to attack other complex issues in a whole of government way, in a much better way, because of this experience. And so it is also a commitment over the next 5 years to measure and adapt the national action plan. So no one will ever be able to think that all of this work is sat on a shelf somewhere. So we will we'll get there, but I think that hopefully our federal pathway will come out. I'm wearing the amazing beaded heart of the Yukon strategy, which is out, which really set an example of how this has to be built bottom up, with Indigenous women leading it, with a good partner in the government, Indigenous governments. And so the Yukon strategy, I think, is an excellent example of what all the jurisdictions need to do. And now we've stolen the deputy minister from Yukon to co-chair the core working group with the amazing Gina Wilson McDougall, our highest ranking Indigenous public service servant. So we're everybody's working, and at Women's College, the motto was non quo sed quo modo. It's not only what you do, but how. And I think that we have learned that that you have to walk the talk of collaboration, and then you get a really much better result.
Absolutely. Thank you so much for that thoughtful response, Carolyn Bennett. Do any of our other speakers, would they like to contribute before we conclude for today? I know it's such a great response. Thank you so much. A great question, Melissa. All right, so this brings us to the end of our event today. On behalf of all of the collaborating groups, I would like to extend my sincerest thanks to all of our incredible speakers for sharing their invaluable insights, perspectives, and experiences with all the attendees. Before we close this event, I would like to share a piece of advice our U of A representative Rupali shared with our team very recently. Strong convictions should be followed by strong actions. Discussions like these are the critical first step to accelerating gender parity, but they are just that, a first step. So keeping with this year's theme for International Women's Day, I choose to challenge all of you and myself to think introspectively about our discussion today and to follow with tangible actions. Through tangible actions in our everyday lives, we can play a key role in accelerating gender parity in our communities and in society at large. Thank you all so much for attending today, and let's keep having this conversation.